Hi, everyone. Good afternoon. This is County Executive Pat Ryan. Appreciate you taking time out of your day for our COVID update. We're going to talk about the ongoing situation with the state of COVID and infection in the county, and then also some updates on our vaccination process. I think the way that I'm increasingly thinking about this is that we are quite literally in a race where the spread of COVID continues. We are very much still in the second wave. However, it is starting to possibly flatten here in the county. But on the other side of that race is our push, and we are pushing as hard as we possibly can to get as many people vaccinated as quickly as possible before the virus can continue to spread, especially to our most vulnerable and at-risk members of our community. So every single day matters, and that's what I've been constantly pushing our team on, pushing our state leaders on, our federal leaders on. Every day that we don't have enough vaccines is a day that the virus continues to make gains, and I'm sick and tired of that. I know everybody else is too, so we're going to keep pushing to regain the initiative here, and we've started that this week, which is very encouraging, but we have to keep pushing harder. Where we're at by the numbers with COVID, and this will reinforce that we very much are still deep in the midst of the second wave. Our total cumulative case numbers now at 7774. Total tests almost 217,000. 5649 thankfully recovered. And unfortunately, in the 2 days since our last update, 5 additional fatalities. 5 additional fatalities from our county just in this 48-hour period. Again, it is quite literally a race for the lives of our family and colleagues and friends. And I'll talk about what we're doing to push and what I'm doing to push on the vaccine side of this. But the other thing that we need to keep in mind is that while we wait for the vaccination process, which is going to take months, we have to continue to do everything we can in our powers to slow down the spread and blunt the spread, get this second wave under control, and get us into the spring. Hospitalizations in the county are holding about steady. Last time we were at 27, now we're at 28 hospitalized in Ulster County, 3 in the ICU, so again, that's holding about level. We still have not seen, especially in the hospitalization numbers, the effects of the holiday season, so it's a little too early to tell there, but we have also not seen a huge new spike, so there's some reason for optimism there, but a little too early to tell in terms of the hospitalization numbers. The active case count, this is continued relative good news, continuing to hold steady under 2,000. You can see on the graph we did dip down a little bit from our peak of the second wave. Hopefully that continues, but again, still a little bit early to tell without fully counting in the holiday effects, which could take 2 to even 3 weeks to show fully. But I'm gonna continue to hope and pray that this continues to go down and that we see that downslope continue, and we're at 1955 right now. The new positive case numbers are encouraging today, down significantly from what they were even 48 hours ago. We are at a 48-hour average of 5.9%. We were almost at 10% 2 days ago. So that is good news that in terms of each day as we're testing residents of the county, we're measuring, of course, how many new positives each day. In the last 48 hours, we tested 2,812, had 166 new positive, putting us at that 5.9% new infection rate, which is down significantly, and that is encouraging. Projections here, you can see best, middle, worst case. That's all determined really by the rate of infection and the new positive rate. So that green line shows that if we can start to bring the new positive rate down and get this under control, we can start to level off again what's been a very steep increase, as you can see on that graph, in cumulative cases. Hospital and treatment capacity, We remain in good shape here with more than sufficient need for the near, medium, and long term, 28 hospitalized, 3 in the ICU, and very, very adequate, beyond adequate capacity remaining if needed, and hopefully not needed. Before I talk about vaccines, once again, because of the very limited doses available of vaccines, which I'll talk about in a minute, without question, our most effective tool right now still remains what we each individually do. The hope and the medium and long-term plan is vaccines, but the short-term plan to control COVID in Ulster County, in New York State, and in the country has to continue to be each of us as individuals, as families, and as groups following the precautions and continuing to follow the precautions that have become hopefully habit for us now in terms of wearing masks, washing hands and using hand sanitizer, and most importantly, avoiding social gatherings and maintaining distance. That is, I know, difficult. I know it's become beyond a burden and beyond a frustration, but it is proven, and it is an effective tool that got us through the first wave. So let's please continue to do that while we work on the vaccination effort here in the county. As a reminder, it was Monday, January 11th, just 3 days ago, that we did open our Ulster County-led point of dispensing site at Kingston High School. I've been there every day, actually, for the last 4 days. And every time I walk out of there with a great sense of both optimism and hope, because we are putting hundreds of vaccines in folks' arms in the county. But I also walk out of there with great frustration because that site has much greater capacity and is not being used right now. That site can do up to 1,500 doses a day, and I'll talk about our numbers, but we're well below that. And I want to be very, very clear about why we're below that and why this is going slower than all of us want. It's very simple. We need more vaccines from the federal government and the state government. We need them now. We needed them yesterday. We need them today. And at this point, as of this moment right now, if we don't get more doses here in Ulster County, we will actually have to temporarily suspend the vaccination operations starting tomorrow. We will have used all of our available doses by the end of today in Kingston and in Ellenville. The Ellenville site was up today running as well. We in the county, I'm really proud of what we've done in getting this site up and it running smoothly, in us getting hundreds of people through a day. We have done our part to have this distribution aspect ready. Now we need the federal government and the state government to step up and push and get the supply ramped up. Without that, this is going to just take far, far too long, and the rate we're going at right now is maddeningly slow for all of us, myself included. So what are we doing? What am I doing to address that? There's a lot of aspects here. A lot of this is just making it crystal clear what our need is. So in the last 2 days, I've been out there not only spending many, many hours on the phone trying to push for additional doses, but actually got both our state elected officials and our federally elected officials to come and see our pod site in Kingston. Yesterday, we were very fortunate to have newly elected State Senator Michelle Hinchy join us to get a sense of what's happening. And then earlier this morning, I was at the site with Congressman Delgado. I want to thank them both for taking the time to come to really understand what's happening on the ground, what our challenges are, what our capabilities are. And they both left, I know, in agreement that we have to push on the executive side, state and federal leaders to ramp up production. Let me give you a sense of the numbers to help you understand what's happening here. So I'm going to put up the numbers of doses we've distributed specifically at our Kingston and Ellenville county-led sites over the last week or so. We got our very first doses on the 8th and administered 110, as I said, starting Monday the 11th. And then for the next several days, we were doing 480 per day. Our capacity at the site with the staff we have, the number of vaccination pods we have, the number of waiting areas, the number of computers, and so on, we could more than triple that number each day if we had vaccines available. We could do up to 1,500 a day, but instead, because of limited supply, we're only doing 480 a day. The encouraging thing is for those 480 people each day, that is a life-changing, very good, positive moment, and now we need to make many, many more of those moments happen much more quickly. Today, we also brought online, in addition to the Kingston site, our Ellenville site. So between the Kingston site and Ellenville today, we did 550 vaccines at our county-led sites. All said and done in the last week, we've received from the state 2,100 doses, and as of this evening at the end of close, we will have distributed all 2,100 of those doses. Our team has been incredible. I mean, we even last night when we had a few extra doses of those that didn't show up for appointments, we were reaching out to say, hey, can you get over here? We want to make sure we use every single dose that we're getting. And so we will continue to be relentless in pushing for that. And even just an hour ago in a call with the Mid-Hudson Regional Vaccine Hub, I was very clear that we can do a whole lot more here in the county once that availability is made. For those of you wondering why this is the case, I share in that wonder and that frustration. I frankly believe that the majority of the problem lies at the lack of a coordinated federal effort early on to say that we are going to allocate the resources and the priority to do this much more quickly and at much greater scale. I mean, we've done this before in the United States of America, not just in response to pandemic, but in response to many, many other threats and challenges. Think of the scale of manufacturing production we did as a country, as an entire society around our World War II mobilization efforts. That is the same level of intensity and rallying that we need to do to meet the urgency of this race that we are in. And here on the ground, we're just not feeling that right now from the federal government. I'm hopeful and optimistic that will change here in about a week, and we'll see it in the numbers and we'll see it in the data, and I hope that those continue to go up. But for now, please know that I and we are doing everything we possibly can, both to advocate for more and to do right and do well with what we do have to get it out there quickly, safely, and equitably, and we'll continue to do that. For those of you out there, the vast majority that are hopeful and wanting to get the vaccine, we have set up our Ulster County specific vaccination resource center. You can access that primarily through our website. I'll put up the site here, vaccinateulster.com. There are three main things that you can do on the site. Number one, lots of frequently asked questions about both the health aspects of the vaccine, but also how our process is working to distribute it, who's eligible, and so on. You can also check your specific eligibility and see, am I in category 1A or 1B? And if so, then you can get on our list. And that's the third thing that you can do. Anyone in the county, regardless of whatever phase or category you are in, if you are interested in getting the vaccine when you're eligible, you can sign up on our vaccine notification request page. What that really lets you do is get on a list, and we've got almost 20,000 people on the list now, and you will get personalized, regular updates to your email telling you the latest in terms of availability of supply. Eventually, once we have more doses, telling you you are now eligible and we have appointments, and here's where you can go to sign up. So signing up for that list doesn't get you an appointment booked yet, but what it does is it'll put you first in line to get that information as soon as we have more doses and we have more appointments. So please do, if you are interested in getting the vaccine, please do sign up on that list. and we'll be sending another update probably tomorrow to that list of our latest status, and we'll keep you all updated with everything that we know. I having been at the site and just talking to so many folks and fielding phone calls, I know how anxious so many people are right now in the county and in our community, especially our seniors and others with health risks and those that are vulnerable, those that are having to go to work and have no choice but to go to work, who are very anxious to get this. And so the minimum that we owe you is detailed and accurate and easy to understand information, and just giving you the straight talk of where we're at and what we need, which I try to do today and we'll continue to try to do. Another thing that we are rolling out to meet one of the specific needs that we're seeing and hearing, many of the processes and ways to sign up, we are using technology, we're using our online portal and an online appointment system, and I recognize that for many in our county, that can be a challenge to navigate and can be confusing to use new technology or possibly to access the internet for a bunch of reasons. In particular, our seniors, we now have anyone 65 plus is eligible, 65 years and older is eligible, as directed by New York State. That's 36,000 people in that category in our county. And so we know, especially for some seniors, navigating the website or the phone line, our county phone line, can be difficult. So I've asked and directed our Office for the Aging, which is a phenomenal team. They are specifically going to ramp up their staffing. So anyone who's a senior in the county who needs help with vaccine information or navigating the different portals, you can specifically call our Office for the Aging. The number is up on the screen, 845-340-3456. We are experiencing on this line and on our Recovery Service Center, we're getting a very high volume of calls from people interested. So I do ask your patience. We're doing everything we can to add more resources to both of those lines. That's partly why we're bringing online the senior specific line as well, to relieve some of that pressure on our other phone line. The good news of this is, of course, that people are wanting the vaccine, and I am optimistic that eventually we will get more, and we're going to do the work now to have everybody informed and ready and queued up to go, so that the moment we get more, we can get it out to everybody in 1A and 1B. So those are the COVID and vaccination updates for today. The only other thing that I wanted to just briefly hit on, we have another important meeting happening tonight here in the county. It'll be virtual, of course, unfortunately, on Zoom, given COVID. But we have been working over the last several months, even through the challenges of the pandemic, to take a hard look at our justice system here in the county, especially in the wake of so many challenges and incidents that we've had related to that in the last year plus, and really for many, many years. Our Justice and Reform Commission that I appointed many months ago has been working and meeting, engaging with the community, engaging with leaders and members from all over the county to get their input. We've put together a draft set of recommendations of reforms to our criminal and our justice systems. And tonight there will be another public town hall meeting focused on and sharing some of those recommendations. And really the goal, as has been throughout the process, is to listen and hear from the community what those concerns are. So if you are able to join that this evening, let me make sure I have the right time. Sorry, I want to make sure I'm not misspeaking. That will be tonight from 6 to 8 p.m. The link is here as well online. You can go as well to our Facebook page and see the invite. It is totally open to the public, and hope for extensive dialogue and public conversation on this topic. I was actually surprised and pleasantly surprised and proud that in Governor Cuomo's State of the State address on Monday, he specifically singled out Ulster County as one of the leaders and examples of addressing these challenges and getting our commission together and having the public voice in it. So I want to thank Governor Cuomo for calling for that. I want to thank all the members of the commission who've been working hard and many, many hours, and all the public that has participated to this point. And please join us tonight at 6 p.m. for the next session related to that. We're working towards a final report that will come out probably sometime in February or March, and then we'll start to implement many of the actions called for both immediately and over the coming years. So not much going on at all. Final note are our thank yous. One of the other great benefits of getting to spend some time at our vaccination site is to get to see and chat with and thank our volunteers. About half the folks staffing the site are volunteers who have all just said, I want to help, and I'm willing to give generously of my time to greet people at the door, escort them to their vaccinations, help them as they're waiting and being observed, help them schedule their follow-on appointments, really representing the sense of service and community that we've seen throughout this pandemic. So I want to thank all of our volunteers and our staff working at the site. One of the small ways that we've been thanking them also as a community is local restaurants have once again stepped up and been generous, giving delicious food to our volunteers and our staff working there. So this week we were able to bring over some great pizza and Italian food, some great food from Santa Fe. So I want to thank Savona's, I want to thank Vincenzo's, and I want to thank Santa Fe Uptown for generously providing a large amount of food to help feed our volunteers and our staff. They've been working nonstop, 10-hour days straight, and we're going to continue 7 days a week, 10 hours a day until we get every single person who wants to be vaccinated. So thanks to those great local businesses. Thank you to all of our frontline workers, whether you're giving vaccines or you're making sure people can get their groceries, or they're getting their mail, all the essential work that's happening at great risk to each of you. Thank you. And finally, as always, closing, if you have questions, you can, and people are very much reaching out to our Recovery Service Center. That number is 845-443-8888. We normally get somewhere between 200 and 300 calls a day during the pandemic into that site. In the last week, we've been averaging 4,000 to 5,000 calls a day to the RSC. So again, we're doing everything we can to add more staff and resources there, but please be patient. Please know that we're doing everything we can to answer your calls, to get the information to you, and to get us through this. So thank you for tuning in. Thanks for being part of the community getting us through this tough year. We're almost there, and we will see you for our next update on Tuesday at 3 p.m. Thank you, Radio Kingston. Thank you, Diane. Thank you, Manuel. And stay safe, stay healthy. Let's continue to be resilient and stick together through this, and we'll see you soon.